Good morning. Hello, everyone. Welcome to Psychopathology. This video is an overview of the course and a closer look at what we'll be covering for psychopathology this week in week one. This week we covered the course policies, textbook assignments and expectation. This was done through a syllabus quiz for the course just to familiarize yourself with the information that is in the syllabus. For the most part, the Blackboard weeks resemble the weeks on your syllabus. However, there may be slight differences between the readings and some of the assignments that are listed on your syllabus with the Blackboard. There may be times that I add more readings to Blackboard, maybe remove some readings from Blackboard as we move along through the course, but for the most part, they should be week one on your syllabus, or your different weeks should be very similar to what you're seeing on Blackboard. Blackboard also has additional functionality, so you'll also see websites there and videos as well listed on Blackboard. All these additional readings or content that is placed is to enhance your required readings. Um, the syllabus has the course policies listed on it. However, there will be some information that I will be uploading for course expectations as well in the course content section. And it's a PowerPoint just to remind you what the expectations are in the course. That PowerPoint will also be duplicated in each week as well, just to keep students abreast and reminded of the course policies related to assignment submission, academic integrity, and so forth. Um, this is an introduction to psychopathology, as well as all the content and resources that you have available that are at your disposal for the course. We have plenty of required textbooks for this course, and I also uploaded the Monograph 3 Perspective, the Monograph 3 Black Perspective monograph that we completed over the summer that specifically looks at COVID-19 mental health and health disparities. And it also is important that you look at that and the readings that are selected from that monograph, because it is pretty much practice, wisdom, experience, and literature that is current in the field today. And it's from colleagues from Howard University. So many of the contributors are either faculty of Howard University and/or PhD students at Howard University, or who recently graduated from Howard University. And so it's very important to know what your peers are examining, reviewing in the field currently as it relates to COVID-19 and the pandemic. You will also see in the monograph there is application of the Black perspective. And so it also gives you an idea of how faculty members and students have incorporated the Black perspective in their view of COVID-19 as it relates to mental health and physical health. This week we also cover the DSM-5, Introduction to the DSM-5, and that is also one of your required textbooks. And it's what we use for diagnostic assessments, as well as diagnostic disorders that we may provide or evaluate a client with. And in this course, you'll be using the DSM-5 heavily, not just to understand different disorders and symptoms of disorders, but also you'll be using it for your case conceptualization. Please be mindful that you have some assignments for this course, and the discussion boards are meant to help you understand the readings for the course, and also see how other students are engaging with the readings and comprehending the readings as well. Also, the assignments are meant to, again, incorporate your understanding of the readings, but also to help improve your diagnostic and treatment planning, intervention and treatment planning skills that you'll need, not just for the licensure, but in professional practice as well. And so we will be relying heavily on the DSM-5 for that. In addition, for your case conceptualization and your case analysis and your case study, you'll be using the DSM-5 to decide to identify clinical disorders that clients may be experiencing in the field or in case studies. You will also be using the DSM-5 in your group work, as you will be selecting disorder that is not already covered in class, and you'll be educating the class in a PowerPoint presentation of a disorder. And so you'll also be using the DSM-5 for that. We'll also understand the specific role and contribution that social work plays in mental health, in psychopathology specifically. Please make sure that you look on Blackboard. The syllabus is there. You're expected to review it in detail, but I also include a video going over the syllabus on Blackboard. In addition, I'll be uploading separate videos for each assignment that we have in the course, and it'll be a review of the assignment for you all, so that you understand what the expectation. You can always review it, the video going over the assignment and the assignment expectations. Please be advised that the assignments are available in the week that they are due. So if you do not see them in Blackboard, the assignment itself for upload is because it's not due. If it's in the week that it is due, you will see the assignment appear on Blackboard. Don't worry, you also have a syllabus, so all the assignment instructions and things that you need is in the syllabus as well. And that, I think, is the most important thing to recognize and understand. You may see the assignments appear in your grade book, though, including the rubric for the assignments. So you should be able to see all the assignments that are due for the course in the gradebook section of Blackboard. Introduction to psychopathology. When we think about psychopathology, we're specifically talking about the study of mental illness or distress, or the manifestation of behaviors and experience that is indicative of psychological impairment. Okay, so we're thinking about mental illness or distress, and evidenced by behaviors and experiences that show us as social work clinicians that there are psychological impairments going on with the client. Clinically significant behavioral psychological syndromes or patterns that occur in individuals associated with present distress and impairment. So we're looking at clinically significant disturbance and changes in behavioral, psychological, and in psychological functioning, in which we can oftentimes apply a syndrome to it. And we're also looking at a pattern, a consistent pattern of these clinically significant behavioral psychological changes. Some terms or readings you may look at, particularly historic, looks at it as a sickness of the mind. There are common terms and historical terms. If you read older literature about psychopathology, you'll see that the language used in earlier practice is very different than the more politically correct terms that we use today. And you will see that as we go along, these definitions and terms evolve. They become more comprehensive, more specific, more person-centered as well. Common terms you'll hear are emotional disorders, mental illness, a psychiatric illness, mental abnormality, and or mental deviation. Historical terms and oftentimes cultural specific terms include someone having a breakdown or a nervous breakdown, lunacy, craziness, nervousness, neurosis. But again, we have moved away from a lot of these historical terms as well, in that we tend to at least try to incorporate language that's more person-centered, strength-based as well too. Key elements of psychopathology or mental disturbances. There's an abnormality. This week we talk about what is an abnormality. How do you know something is abnormal? What compass are we using to understand abnormality? Well, the first thing that is important that you know is there's no agreed upon definition on what abnormality is. The other thing is who classifies what is abnormal, right? Who has the power to decide what's normal versus what's abnormal? I think we've seen that a lot in the last year and in our political climate in terms of people's behaviors and expectations and even responses to COVID-19. So who classifies what is abnormal? Couple places you want to think about is the American Psychological Association, the DSM-5, panels of experts that create and update um, DSM-5. Abnormality is not reduced to just clinical expert opinion or professional associations that have expertise in mental health, but also culture plays a part. Um, Race, religion, spirituality, all these things are what you think about when we talk about norms, cultural norms, societal norms, laws, policies. All these things have elements of normalcy, and so the comparison is what is listed in terms of statutes, policies, expectations in a society versus what a person is experiencing. And that can change from society to society, culture to culture. So those cultural considerations are very, very important. Um, we can also talk about gender and gender inclusiveness, and all those things also intersect with culture and how we view um, what we view as normal and abnormality. So, in order to move forward with this course, we really have to first stop and understand that when we're talking about mental health, when we're talking about disorders, we are looking at a form of abnormality. But we also have to be very important that there's a lot of politics, there's a lot of cultural implications, socioeconomic implications when we're really considering abnormality. So, we need to be very, very careful that we understand abnormality in its proper context. In basic definition form, it is a deviation from social or statistical norms. But is it? This is something I want you to think critically about as you move along in this course and your understanding of mental health and mental disorders. Key elements of abnormality are maladaptive behaviors, which are behaviors that do not um, serve a person well or serve a person's well-being. These are behaviors that tend to hurt, that stunt growth, that impedes goals and development for people. And so they maladaptive behaviors adversely affects individuals or society. But again, who judges these measures? Who judges what's maladaptive? Hopefully, this is the work of the clinician and the client together. Oftentimes, we also look at abnormality as causing some type of personal distress for the client. But what if there is no reported distress? What if distress is unknown? What if a client has normalized trauma and stress? So they may not even be aware that they're under stress, or even they're not sometimes aware of the high levels of stress that they may be experiencing. One of the things I would like to think about is in one of the measures that we use for abnormalities and impairments are some type of change in level of functioning. And usually that level of functioning is impaired. So areas of examination, we're looking at normality and abnormality, are biological origin, genetics, hormones, plays a role in abnormalities and particularly mental health problems. We're also looking in the area of cognitive, that can be neurological, how the brain operates, how the brain works, but also includes thoughts as well. And so we're looking at these areas and looking for differences in those areas that may impact functioning. We're also looking at social and contextual factors such as environment, and how people are socialized. So again, when you're thinking about examining abnormality and functioning, you're looking in areas of the biological, cognitive, as well as the social implications. The main source that we're using when we're thinking about abnormality and what's normal is the DSM-5. This is the main source for identifying psychopathology and or emotional behavioral manifestations for psychopathology. There is limitations in its use and applications, and the readings talk about the limitations in its use. It is the gold standard, what we use for diagnostical purpose, and we also use the diagnosis to help form the basis of our intervention and treatment plan. But it's not without its limitations. One, the cultural context in which the DSM-5 is created and administered is not always culturally friendly to all. And again, it has its own issues of abnormality. There are things that are in the DSM-5 that we accept and we embrace today as differences, cultural differences, gender differences that in prior editions of the DSM-5 was considered abnormal and or sick and or sickness of the mind that we don't do that today, but something to consider. Um, Prior versions were of the DSM-5, and even in our language, as I stated, related to mental health, are grounded and based in the foundations of political, social, historical factors. And as we've changed our knowledge base and it's become more evidence based, and that is through practice as well as research, we have changed the DSM-5. So again, you could get a disorder. You can be diagnosed as one disorder in our earlier version of the DSM-5, where we've eliminated some of those. We've eliminated, combined, expanded disorders all the time, and so that's the limitation. If you're diagnosed in a particular period of time, you may get one type of diagnosis, and today that diagnosis may no longer exist. One example of that is postpartum depression. Um, in earlier versions, postpartum depression is listed. Now, currently, it has been incorporated under depression, but they just now add a qualifier, which is with postpartum onset. There are other examples of this as well, autism as well. A lot of developmental disorders have now, that we've had before, have now expanded under autism and is now considered autism. Those are just two examples. And so we know that there's limitations in the use and application of the DSM-5, and it changes. And oftentimes, again, based on political, social, historical factors, those changes also occur related to that. And so we know that it's a moving target. Technology also has changed how we look at disorders, understanding of the brain, how the brain functions, has also enhanced our knowledge. And so you will see changes based on our how we classify, categorize, and the symptoms of disorders when we know more about uh, the brain and people in general through technological advances. And we've also modified definitions. Sometimes we've expanded them, sometimes we've limited them. And through expanding and limiting definitions of disorders and symptoms, may indeed change the disorder itself and or how we're diagnosing people with it. We have plenty of different iterations of the DSM, starting off with DSM-1 in 1952, DSM-2 in 1968, DSM-3 in 1980, DSM-3R 1987, DSM-4 1994, DSM-4 TR in 2000, DSM-5 2013. This video talks about abnormal psychology, and we will take a look at it now.
It is Psychology 350, and this is Dr. Moore. In this course, we'll take a closer look at various mental disorders. But before we begin, let me point out that these lectures are in addition to your thorough reading and studying of the assigned chapters each week. The video lectures are meant to highlight points from our readings and to help you understand important concepts. But the entire chapter is important, so don't skip over anything not covered in the lectures. You may want to first skim the chapter, then listen to the video lecture, then go back and read the chapter carefully in its entirety. I'm looking forward to our learning experience together, and as we continue, think about how we define abnormal. Normalcy is a majority concept. That is, it is the standard of many and not the standard of one person. It is defined by what the majority of people think and do. Consequently, normal is culturally defined, and it can change across cultures and over time. we have to consider the context in which the behavior occurs. Among other things, we'll look at the criteria for defining abnormality. We'll also look at the prevalence of mental disorders, which may surprise you. Each lecture will conclude with a look at some contemporary trends. Now, there have been a lot of changes in the field of abnormal psychology over the years in the understanding and treatment of mental disorders. These include an emphasis on research in guiding therapy, the drug revolution, as there have been many new medications developed with fewer side effects, and they have shown to be better at managing symptoms. Another trend is positive psychology, where researchers have been studying healthy people to learn about resiliency and happiness. And also the recovery movement has drawn a lot of interest recently. Finally, there's been an increased use of technology in treatment, including the use of social robots. Here's a picture of Zeno. Zeno is a social robot that helps engage children with autism. Zeno was developed by researchers at the University of Texas, and it's believed that Zeno can help us to better diagnose and understand autism, because some autistic children are more likely to interact with the robot, which is seen as less threatening than human interaction. And here is Neo, another social robot developed in Singapore designed to help kids with autism to express their feelings. Neo sings, dances, and tells stories. So let's get started. Abnormal psychology is a division of psychology that studies people who are abnormal or atypical compared to the members of a given society. Often a person's thinking or behavior is considered abnormal if it violates the unwritten social norms or rules about what is expected or acceptable in a particular culture or social group. This unit asks you to think about what abnormal means and how we differentiate between normal and abnormal. But deciding when abnormality exists is not always that easy. Consider these examples: a man kissing another man, a man barking like a dog, a woman slapping a child, a woman refusing to eat for several days, a man driving a nail through his hand, a woman making a shrine and offerings to her dead husband. As you can see, we may need some more information, and we have to consider other things before deciding whether someone is behaving abnormally or not. Would you say these individuals are in need of treatment? Or are they deviant? Would you diagnose them as mentally ill? As you can see, we need some criteria to help us decide whether abnormality exists. Abnormal psychology focuses on psychopathology, which is the scientific study of symptoms and causes of mental disorders. Its objectives are describing, explaining, predicting, and modifying behaviors associated with mental disorders. And you might want to note that there are 4 objectives here. People who work in the field strive to alleviate the stress and life disruption of those with mental disorders. Now, there's a table on page 7 in Chapter 1, which lists the various mental health professions and the training, education, and credentials needed to practice as a clinical psychologist, a psychiatrist, a psychiatric nurse, a social worker, or a substance abuse counselor, for example. And it's interesting to note that often psychiatrists don't have much training in treating and addressing substance abuse problems. Psychiatrists are medical doctors who have specialized in treating psychiatric problems, and they can prescribe medications. Now, some states are allowing licensed psychologists who have PhDs to prescribe certain medications if they have the appropriate training. We're going to take a close.
This video is only going to play just the first part of that video, just so you get a sense of of the part where they're talking about abnormality, how it's considered and how it's conceptualized. Please take time to watch the entire video as it is a very helpful and it's a supplement to this week's work. Now I want to talk a little bit about social work and psychopathology. Historically, psychopathology was taught to social workers by psychiatrists. Psychopathology has gained more importance in social work education and curriculums across the country and internationally. Today, many schools of social work focus solely in clinical social work practice. So that means a lot of schools of social work have a clinical focus and provide certifications based on that clinical focus. There are many social workers, though, that are opposed to the use of the DSM because of the limitations that I discussed before, but there are also other concerns of what the DSM-5 classifications and the symptomology may mean for clients themselves. For example, there's a lot of labeling of clients, stereotyping of clients, and so this means that there are adverse impacts to clients. So oftentimes, there is a belief in self-fulfilling prophecies related to disorders. There's also an overemphasis on stressing problems, weaknesses of individuals versus personal strengths, which again it goes against ethical values and beliefs of the profession of social work. There's also belief that that the DSM is unidimensional in terms of its label versus multidimensional, and in which clients present oftentimes in a multidimensional fashion. Again, there's some concern about the over categorization and over generalization of DSM in a profession that prides itself on the value of individuality, excuse me. Also, there is some true issues and challenges related to the mislabeling of people based on the DSM-5 or misapplication of the DSM-5. Similarly, the misclassification as well. Today, social workers are the largest group of mental health and substance use providers. There are about 35.3 clinically trained social workers per 100,000 Americans. The Bureau of Labor Statistics state that mental health substance abuse social workers are expected to grow by 23% between 2012 and 2022. And that was before the advent of COVID-19. So that number may actually increase. This is pretty much good hard evidence to let you know that clinical social work or social work mental health social work's role in mental health is growing and will continue to grow. This growth is larger than all other occupations. So this is a quick review of psychopathology. Please take the time to review the video, and also make sure that you're doing your readings to have a firm, more comprehensive understanding of this week's overview and introduction to psychopathology. Thank you.